Talking now about digitalization in patient care. Name and company, please.
I'm Zisis Sotiriou. I'm the regional COO for a cluster of 8 countries in Affidea. Affidea is the largest pan-European healthcare provider in advanced diagnostics, cancer care and outpatient. We're operating 320 medical centers in 15 countries. We perform more than 20 million examinations per annum. And we employ across the 50 countries 11,000 people. Out of them, 7.5 are medical professionals.
What are the key challenges you're finding at the moment?
We see a shift on the expectations of both patients and payers. Patients are adopting more and more consumer habits, and payers are looking for cost containment in simple terms. The cost is becoming unsustainable for them. Healthcare is evolving. More and more nuances are coming in front, and this means that they need to provide more diagnostic examinations, they need to provide more treatments and more pharmaceutical products, which is impossible with the current situation to be sustainable.
So how are you addressing that then?
We are introducing care coordination programs in outside hospital environments. The main effort is to keep the population healthy on behalf of the private insurers for the time being, and hopefully, why not, for the public insurers as well in the future. Usually private adapts faster in Europe than public. We are already contracted with some private insurers in some countries with a capitation model. We are reimbursed per capita every year for a certain insured population to keep them healthy by navigate them across the different services outside hospital environment. And we have very good results for the time being.
So what about the opportunities that you see coming up?
We see digital being accelerated. Digital penetration is accelerated, especially after COVID pandemic crisis. We already adapted in the past 2 years a lot of digital tools that help us to improve our care coordination capabilities. And we see AI actually to start really giving an impact in what we do, because previously, before COVID, I would say there were a lot of discussions around artificial intelligence, a lot of promises, but tangible outcomes were not there. But right now, I think we matured and we reached to a point that we can really see specific tangible examples, outcomes coming from artificial intelligence. On our end, just an example, we managed to improve our efficiency. COVID resulted in significant backlogs. People were not exiting home, they were afraid. In some countries, access to healthcare became more narrow, resulting higher waiting lists nowadays. With artificial intelligence and optimization of the workflow, we managed to improve our capacity utilization rates and make healthcare diagnostics more accessible for the general population.
That's great to hear. Thank you so much for those insights. Thank you.
Thank you. Thank you very much.